Health officials revealed that 8 to 10 snake bites are recorded annually. The Health Ministry is ensuring residents know how to avoid these reptiles with a series of snake bite management training courses. One such session was hosted for farmers on Wednesday at the Stanley John Odlum School of Arts, Media and Design.
Even though we don't have many happening every year, we want to avoid snake bite as much as possible. So we were working towards bringing the numbers down even more, educating the public. And one of the things we plan to do to ensure that persons are kept abreast with what's happening, all the persons involved, all the stakeholders, we want to do tabletop exercises as well as a drill later in the month of March, where we're going to bring in the farmers and bring in firemen as well as forestry officers and our clinical team. We'll have to have discussions to allow that to happen. In that way, even though we don't have snake bites happening every month, persons will keep themselves abreast with the treatment and what they need to do to prevent themselves from getting bitten. But if they get bitten, what they need to do to get the treatment as quickly as possible.
The snake bite management training falls under the Health Ministry's Universal Health Coverage Program. Director Dr. Alicia Eugene Ford expounded on the free snake bite treatment and care.
When a patient actually gets to the hospital, whether it's St. Jude's or OKUH, there's a package they're not going to pay for, and that includes everything: the antivenom, the analgesics, which is the painkillers, the antibiotics, the lab test. If they have to do any imaging studies like x-rays as well, that'll be covered for. Hospitalization costs, outpatient clinic review, and physiotherapy review. Surgery will be covered as well.
The fire service is usually the first to administer care to victims. Officials want individuals to refrain from practicing home remedies and seek urgent medical attention if bitten.
If you allow for your blood to circulate normally, it takes longer for the venom to travel through the body if you are not very active, that is. And it allows for you to still have use of that body part where you got bitten after you get the treatment. So you advise persons not to do the tying. Okay, also no sucking away at the venom site, at the bite site. No pouring on of alcohol, turpentine, G's, kerosene, all those things that they normally do. We don't advise them to do that. And another thing is we want them not to try not to walk as much as possible. So if you get bitten, yes, it's okay for you to get over to a safe place. However, try not to exercise the body too much, use your muscles too much, because as muscles move, blood is being transported through that area and will cause for the venom to travel a little faster. So if you have help, someone around that could carry you, that would be the better option.
The training also targeted people living in rural communities and adventure seekers. Some 60 farmers from the West were set to benefit from the training. Clement Fouché, a farmer from Millet, was among them.
I feel, well, it's very informative, it's very good, telling us about, the snakes we have in St. Lucia, that will go a long way in helping us, how to protect ourselves, how to guard ourselves, from snake bites. And if we were supposed to get bitten by a snake, what to do, and how to reach in the hospital.
The Health Ministry also planned an afternoon session for Dennery and Mico farmers. St. Lucia is home to 4 living species of snakes, one of which is venomous. They are the tiny, harmless worm or thread snake, the St. Lucia racer, the tree-dwelling boa constrictor, and the extremely venomous snake of the pit viper family, the Furdelance or St. Lucia lancehead. Gina Philippi, HDS News Force.